Good morning students. So in the previous class I had dealt with Down syndrome. So in this video I will be taking class regarding the topic head injury. So head injury, already I have taken you all in the medical surgical nursing, that is what is head injury. So what is head injury now? So head injury, it is any sort of injury that usually occurs to the brain, skull or scalp. Okay, head injury, it is usually any sort of injury that usually occurs to the brain, skull and scalp. Okay, head injury is any sort of injury that usually occurs to the brain, skull and scalp. So this can be like a mild, it can range from a mild bump, like a swelling like it will, so that is usually from that, to bruise or to traumatic brain injury. Okay, so that is, it can range from a mild bump or bruise or to a traumatic brain injury. So head injury is nothing but injury to the brain, skull or scalp. So that usually ranges from a bump, a mild bump, bruise or to a traumatic brain injury. So common head injuries are mainly includes, there are different types of head injury. I already have told you, like contusion, skull fracture, scalp wound. So these are usually common head injuries. Okay, these are usually common head injuries that includes concussion, skull fracture and scalp wound. So that is usually about this head injury. So what is head injury? So head injury is any sort of injury. Okay, so head injury is any sort of injury to the brain, skull or scalp. Okay, brain, skull or scalp. So this is usually ranges from mild bump to bruise or to a traumatic brain injury. Okay, to a traumatic brain injury. So that is usually there. So there are different types of there are common head injuries includes concussion and then skull fracture, contusion as well as scalp wound. So that is usually about this head injury. So next is causes. So what might be the causes? So causes are same like fall from a height, motor vehicle accidents, birth injuries, sports related accidents as well as physical assault. Okay, the common causes for this head injury are fall, motor vehicle accidents, birth injuries and then physical assault as well as sports related accidents. Okay, sports related accidents. So that is usually about the causes of head injury. So causes of head injury, it mainly includes fall, motor vehicle accidents, birth injuries, physical assault as well as sports related accidents. So that is usually about these causes. So next is, so usually these causes are divided into different age groups. Okay, in case of pediatric cases, when we take, the causes are divided into different age groups. So first is in case of neonates. Okay, first is in case of neonates. So the cause is mainly birth injuries. Okay, the cause is mainly birth injuries, and this birth injuries, it occurs mainly due to when they are using this instrumental delivery as well as sudden unassisted birth. Okay, or in case of sudden unassisted birth. So in case of these causes, it usually depends upon the different age group. Okay, according to different age group, the causes are different. So in that first is neonates. So when we talk about this neonates, so it is usually mainly due to birth injuries. Okay, in this neonates, it is mainly due to birth injuries. That is in case of instrumental delivery or in case of unassisted birth. Okay, unassisted delivery or unassisted birth. Okay, so that is usually is there. So next is in case of infants. Okay, in case of infants, that is fall from the bed. Okay, in case of infants, it can be from the fall from the bed or fall while learning to walk. Okay, fall like learning to walk or learning to sit. So that is usually there, or sudden blow by siblings. Okay, or by sudden blow by siblings. So that is usually the causes of head injury during infants. So that is usually, it might be fall from the bed or it might be due to they get injured when they are learning to walk, stand or to sit. So when they are learning to sit, that time also they might get developed this head injury, or when there is a blow from the siblings. So that is usually in case of infants. Then in case of toddler and preschoolers, again toddler and preschoolers, so that is usually fall from the stairs. Okay, they will be learning to climb the stairs, so that time they might fall from the stairs or fall from the height. Okay, they might climb on chair or they might climb on the, so that time also they might fall from the height, and also they might fall from playing when they are playing. Okay, when they might fall when they are playing. So that is usually there, pulling objects and that might fall on their head. Okay, when they are pulling objects, that might, they want some objects and when they are pulling that objects, that might fall on their head. So that is usually there. So that is usually about this toddlers and preschoolers. So toddlers and preschoolers fall from the height, fall from the stairs, and while pulling some objects, it might fall on their head. So that is usually about this causes in case of preschool and toddler. So next is in case of children. So that is usually when it might be automobile accidents. Okay, in case of other children, it can be automobile accidents or road traffic accidents or sports injury. Okay, or sports injury, sudden fall. So that is usually the causes for this head injury in case of children. So that is mainly playing on the road, road traffic accidents, automobile accidents, sports injury or fall from the height. So these are usually the causes of head injury according to different age. So in case of neonates, it's birth injury. In case of infants, it might be fall from the bed or fall when they are learning, okay, when they are learning to walk, stand, that is usually there, that sit, that is usually there. Next is in case of preschooler and children, it might be like when they are pulling some object, it might fall on their head. It might be like fall from the stairs, so that is usually there. And in case of children, it can be like road traffic accidents, automobile accidents, sports injury or fall from the height. So that is usually the causes of head injury for different age groups. So the next is types. So in case of types of injury, the first is hematoma. So what is hematoma now? Hematoma, it is usually collection or clotting of blood outside the blood vessels. Okay, hematoma, it is usually collection or clotting of blood outside the blood vessels. Okay, so that is hematoma is a collection or clotting of blood. Okay, it is usually collection or clotting of blood outside the blood vessels. Okay, outside the blood vessels. So this can be serious. Okay, this can be serious if it occurs in the brain. Okay, this hematoma can be serious if this occurs in the brain. So what is hematoma? It is usually collection or clotting of blood outside the blood vessels, and this can be serious when it occurs in the brain. Okay, it can be serious when it occurs in the brain. So that is because the clot which is formed, okay, the clot which is formed, it usually creates pressure. Okay, it usually creates pressure. It builds up pressure inside the skull. Okay, it builds up pressure inside the skull and can cause unconsciousness and can cause loss of consciousness. Again, can cause loss of consciousness. So that is hematoma. So hematoma, it is a collection or clotting of blood. Okay, hematoma, it is usually a collection or clotting of blood that usually occurs outside the blood vessels, and this can be serious if it occurs in the brain, because this clot can create pressure on the skull. Okay, it can create pressure on the skull and can cause loss of consciousness. It can cause loss of consciousness. So that is usually there. So this hematoma can be two types, that is extradural hematoma and subdural hematoma. Okay, so this can be of two types, that is extradural hematoma and subdural hematoma. So what is this extradural hematoma? This occurs it occurs after head injury. Okay, it usually occurs after head injury. So mostly in this, usually what happens, temporal lobe or frontal lobe will be affected. Okay, temporal lobe or frontal lobe will be affected. So that is usually this. So this occurs after head injury, and mostly temporal lobe or frontal lobe will be affected. So that is usually about this extradural. Subdural, in this usually occurs after severe injury. Okay, it usually occurs after severe injury. So there is accumulation of blood fluid in the subdural space. Okay, there is accumulation of blood fluid as in the subdural phase. That is between dura mater and arachnoid mater. Okay, that is between dura mater and arachnoid mater. It can be acute or chronic. Okay, it can be acute or chronic. So it is usually in case of hematoma. Hematoma, it is nothing but collection or clot of blood outside the blood vessels. It can become serious when it occurs in the brain. So here usually what happens, the clot usually creates pressure on the skull, where it usually causes loss of consciousness. Of two types, extradural and subdural. Extradural occurs when there is head injury, and in case of subdural, it usually occurs when there is severe injury. So here usually the collection of the blood fluid, everything is seen in the subarachnoid space, that is between dura mater and arachnoid mater. Okay, that is between dura mater and arachnoid mater. So that is usually about this types of hematoma. So next is edema. So what is this edema? So any brain injury can lead to this brain swelling or edema. Okay, any brain injury can lead to brain swelling, or any head injury can lead to this brain swelling or edema. This is mainly due to vascular congestion. Okay, it is mainly due to vascular congestion. Okay, so any head injury can lead to this edema or brain swelling. This is mainly due to vascular congestion. Okay, it is mainly due to vascular congestion. So next is intracranial hemorrhage. Okay, so next is intracranial hemorrhage. So it occurs in neonates. It usually occurs in neonates at the time of delivery. Okay, so intracranial hemorrhage usually occurs in neonates, that is at the time of delivery of the head. Okay, that is time of delivery of the head due to excessive molding. Okay, due to the excessive molding of the skull. Okay, due to the excessive molding of the skull, or if they are using this instrumental delivery, that is especially in case of forceps delivery. Okay, if they are using this instrumental delivery, that is especially forceps delivery. And about 15 to 20% of the death, neonatal death, occurs due to this intracranial hemorrhage. Okay, 15 to 20% of the death usually occurs due to this intracranial hemorrhage. So that is usually about this intracranial hemorrhage. So intracranial hemorrhage it occurs in neonates. It usually occurs in neonates during the time of delivery of the head, that is due to excessive molding, or in case of usage of forceps delivery. So majority of the cases, like 15 to 20% of the neonatal death, it is mainly due to this intracranial hemorrhage. So it is usually about this thing. So next is concussion. So concussion is a brain injury that occurs when brain bounces against the hard walls. Okay, so concussion is usually a brain injury that occurs when brain bounces to a hard wall. Okay, that occurs when the brain bounces to a hard wall. So that is usually hard walls of the skull. So that is usually bounces to the hard walls of the skull. So that is usually concussion. So concussion, it is usually a brain injury that occurs when the brain bounces to the hard walls of the skull. Okay, when the brain bounces to the hard walls of the skull. So this is usually what happens. The main cause for this, it is an injury to the occipital region. Okay, the main causes for this, it is mainly injury to the occipital area. Okay, the main cause for this, it might be injury to the occipital area. So that is concussion. So next is contusion. Contusion is nothing but bruise or petechial hemorrhage. Okay, contusion, it is nothing but a bruise or petechial hemorrhage in the brain. Okay, hemorrhage in the brain. So this occurs at the site of blow. Okay, this usually occurs at the site of blow following direct trauma. Okay, following direct trauma. So that is contusion. It is usually a bruise or petechial hemorrhage that usually occurs in the brain following trauma, or following at the site of the blow. It usually occurs at the site of the blow. So that is usually about this contusion. So next is skull fracture. Skull fracture is nothing but break in the skull bone. Okay, skull fracture is nothing but break in the skull bone. So that is usually about this skull fracture. So skull fracture is nothing but break in the skull bone. So these are different types, like linear fracture will be there, basilar skull fracture will be there, depressed bone fracture of the skull, as well as diastatic skull fracture. So this all I have told you in the medical surgical nursing, so you can refer that. So normally skull fracture, it is usually break in the skull. So that is mainly, it includes like linear skull fracture will be there, basilar skull fracture, diastatic skull fracture, as well as depressed bone fracture of the skull. Okay, depressed bone fracture of the skull. So this is usually about this different types of head injuries, that is hematoma. Hematoma is nothing but clotting of the blood outside the blood vessels. This is of two types, extradural and subdural. Next is edema. There will be swelling of like swelling when there is head injury. There will be brain swelling or edema. That is mainly due to vascular congestion. So next is concussion. Concussion, it is usually occurs in the neonates at the time of delivery of the head. That usually occurs due to excessive molding. So next is contusion. It is nothing but bruise or petechial hemorrhage that occurs in the brain when there is sudden blow to the site of the trauma. So that is usually there. Skull fracture is nothing but fracture of the skull bone. That is of four types: linear skull fracture, basilar skull fracture, diastatic skull fracture, as well as depressed bone fracture of the skull. So that is usually different types of head injury. So next is symptoms. So the common symptoms for minor head injury. In case of minor head injury, what are the symptoms that you can see? It is mainly, so this is head injury mainly includes like mild head injury and moderate head injuries. So the symptoms are should divide into mild head injury, symptoms of mild head injury, as well as symptoms of moderate head injury. So in case of mild head injury, okay, so when there is mild head injury, so therefore you can see that just a swelling or a bump will be there at the site of injury. Okay, so there will be a bump at the site, like swelling will be there at the site of injury. Next, superficial cut in the scalp. Okay, there will be superficial cut in the scalp. Headache will be there, as well as nausea will be there. Then temporary ringing in the ear. Okay, temporary ringing in the ear. So that is in case of this, so that's mild head injury. Okay, so in case of the symptoms of this mild head injury, so symptoms of mild head injury, it can be like there will be bump or swelling at the site of injury. Superficial cut can be seen in the scalp. Headache will be there, as well as mild ringing in the ear. So this is about this mild symptoms. So next is moderate symptoms. So moderate symptoms to severe symptoms. Here immediate attention should be, medical attention should be given. Okay, moderate to severe head injury. So in this usually immediate attention should be given to the children. So what are the things that will be? They will be confused, loss of consciousness will be there, blurred vision, severe headache will be there, vomiting will be there, loss of short-term memory. Okay, they will be having loss of short-term memory, balance problem will be there, coordination problem will be there, abnormal eye movements. Okay, they will be having abnormal eye movements, slurred speech, dizziness. Okay, so they will be having slurred speech, dizziness, as well as difficulty to walk. Okay, as well as difficulty to walk. So then they will be pale in color. Okay, so they will be having pale in color. So they will be continuous sweating, seizures develops. Okay, seizures develop. Behavior also changes. Okay, behavior also changes. And also you can see some blood or clear fluid will be draining out from the ear. Okay, they'll be having blood or clear fluid will be draining out from the ear as well as nose. So muscle control will be lost. Okay, they'll be having loss of muscle control. Open wound will be seen in the head. Okay, open wound or cut will be seen in the head. So that is usually about this thing. So that is usually the symptoms, which is like moderate to severe head injury. So mainly this requires immediate attention, like they'll be having confused, loss of consciousness, coordination will be lost, balance will be lost, loss of muscle control will be there, open cut or wound will be there. Next, blood vision, speech will be disturbed, blood or liquid will be drained from the ear, difficulty in walking, sweating will be there, seizures develop, and also they will be having abnormal eye movement. So this is usually about the symptoms of this head injury. So symptoms of this head injury mainly divided into mild symptoms and moderate to severe injury symptoms. Mild symptoms, it usually they will be having swelling or bump will be there at the head side of thing. Vomiting can occur, headache will be there, and also they will be having like temporary ringing sound near the ear. So that is usually there. Next, in moderate to severe injury where immediate attention they require is a confusion, loss of consciousness, blurred vision, slurred speech, and also they will be like having sweating, seizures develop, and also they will be having loss of muscle control, loss of short-term memory loss, open or cut will be seen in the skull, abnormal eye movements. So that is usually there. Dizziness will be there, difficulty in walking. So these are usually the symptoms that is usually seen in case of head injury. So what are the diagnoses we go? X-ray, CT scan, MRI scan, then detailed history should be taken, like birth history has to be collected. Okay, detailed birth history has to be collected. So that is usually there. Then physical examination should be done. History should be collected, detailed history should be collected. Physical examination should be done. That is usually there. Other than that, we go with blood test, X-ray, MRI, CT scan. X-ray and CT, like X-ray, MRI scan, CT scan will show the site of fracture. Okay, site of fracture, like skull fracture, if it is there, you can easily see with this help of X-ray and CT scan. Then ECG should be done, like EEG should be done, mainly to check about the electrical activities, because there will be loss of consciousness. In order to do check that, we have to go with EEG. So this is usually about this diagnostic test that we have to go in case of head injury. So mainly we go with detailed history has to be collected. Okay, detailed history has to be collected. Then we go with physical examination. Then we have to go with other diagnostic tests such as blood test, CT scan, X-ray, MRI scan, EEG has to be done. So next is management. So what is the management that we go? So mainly it includes like medical management. So medical management, like in case of this management, mainly depends upon the severity of injury. Okay, it mainly depends upon the severity of injury. In that, first is emergency management. So what is this emergency management? So in case of this emergency management, first we have to hospitalize the kid. Okay, so first we have to hospitalize the kid. Then we have to start with life support measures have to be started in case of severe cases. So if there is severe cases, then we have to start with life support management. So mainly the management mainly depends upon the severity of the injury. So mainly it includes like in case of emergency management. Okay, in case of emergency management, the baby should be hospitalized. Then life support maintenance management should be started. So it is mainly maintenance of airway. Then establishment of respiration. Then circulation has to be maintained. Temperature has to be maintained. So that is life support maintenance management should be done. Then we have to go with assessing the neurological status of the child. Okay, we have to go with neurological assessment of the child, or that has to be done. Nasogastric intubation should be done. Okay, nasogastric intubation should be done. Then catheterization should be done. So that is usually that. Blood transfusion should be arranged, or if it is required, it should be started. So that is usually done. So that is in case of emergency management. Mainly we go with like hospitalization. Life support management is done. Oxygen inhalation should be started. Then we go with nasogastric intubation will be done. Then assess neurological status should be assessed. Catheterization should be done. So this is usually the emergency management that we go. So in case of medical management, so we have to continuously monitor the vitals of the child. Okay, we have to continuously monitor the vitals of the child. Treatment of convulsion should be done. Okay, seizures develop, so we are going to prevent and treat the convulsions. Then secondary infections have to be prevented. Okay, secondary infections have to be prevented. Like antibiotics should be given for the kids. Like seizure medication should be given to the kids. So that is usually there. So next is surgical management. So in case of head injury, if it is severe and with this medical management, emergency management, if it is not reduced or it is not cured, then we go with start with surgical management. That craniotomy will be done. So craniotomy, burr hole, everything have dealt in medical surgical. So refer that. So this craniotomy is done. Burr hole it is usually done. This is done mainly to remove the hematoma. It is done mainly to remove the hematoma. So it is then repair of the CSF leakage. Okay, the repair of the CSF leakage should be done. Then penetrating wound should be repaired. Okay, penetrating wound should be repaired. So this is usually about this management of head injury. So management mainly depends upon the severity of the injury. First we go with emergency management. In case of emergency management, hospitalization should be done. Then we have to go with life support should be started. Then neurological status should be assessed. Oxygen should be started. Nasogastric intubation should be started. Catheterization should be done. Blood transfusion should be done if needed. Then medical management, we go with treating convulsions and preventing secondary infections. Next, in case of surgical management, above fails, then we go with surgical management like craniotomy, a burr procedure will be done. Then we have to repair the penetrating wounds. Okay, we have to repair the penetrating wounds, and then we have to repair the CSF leakage. So this is usually about this management of head injury. So head injury is nothing but injury to the brain, skull and scalp. So they are mainly it is due to fall, road traffic accidents, sports injury. So that is usually and in case of birth injuries, and it causes is different for different age group. Types are mainly hematoma, edema, intracranial hemorrhage, contusion, concussion and skull fracture. So this is about this head injury.